Today we are going to give you a brief overview of barbiturates. Now the first thing that needs to be done is we need to give you a brief understanding of what barbiturates actually are. Then we're going to talk about the history of barbiturates, followed by the effects of barbiturates, and then finally we're going to talk about treatment plans that are possible for people who might be addicted to barbiturates. Now the first thing that needs to be known about barbiturates is that it's a sedative or a hypnotic. Now what that means is that it's very likely that barbiturates are used as a sleeping pill. It's sleep inducing. Other uses of barbiturates are to calm anxiety, and then further on down the development of barbiturates, they were used to calm seizures and epileptic spells, and then anesthetics in hospitals. So now a very basic understanding of how they affect the human body is that they're GABA receptor antagonists. They're substances that inhibit neural firing. Basically what they're doing is they depress the central nervous system. They make your whole body calm. Some of the brand names that need to be known are Seconal, Nembutal, Luminol, and Amytal. Also, for clinicians and doctors alike, it is very important to know the street names of these drugs. Some of those are Barbs, Sleepers, Tootsies, Yellow Jackets, and Stumblers. Now the history of a barbiturate is actually pretty far back, but where we'll start is in 1864 with Adolf von Baer. He is coined and he is given credit for coining the phrase barbiturate, but also he's the one that first discovered the uric acid component in apples combined with other synthetic components that make people tired. So what he did was he made the synthesized component and titled it barbiturates, but it also had a second name of malonuric. Now, von Baer has an interesting story of what people think how he named the name barbiturate, because that's important to know where the name came from. Except the history shows that people don't actually know where it came from, but there's three competing stories that people usually go to. One is that he had a really dear friend named Barbara that he named the drug after. Two is that the day that he discovered it, he went to the tavern to celebrate, and he ran into a bunch of gentlemen who were celebrating the day of Saint Barbara, the patron saint. And three, there's a barbed appearance in the crystals in the uric compound. So whether it's one of those three, von Baer is still credited with the discovery of the first barbiturates. Now, after von Baer came Joseph von Mering and Emil Fischer. So it's von Baer, von Mering, and Fischer up on the screen. And each of the two men, the further two men, are known for making the drug what it is today, and they are the ones that actually introduced the drug to a clinical setting. Now, when von Baer first developed the drug, he tried it on certain patients, and one of the biggest arguments that they had about it was that it didn't allow them to really wake up in the morning. They were drowsy for hours and hours after they had woken up in the morning. So obviously, as a new drug, it wasn't perfect. Now, von Mering and Fischer were able to discover Barbital, which created a different kind of experience for people who use the drug, and they were able to wake up in the morning. It had a combination of the general downer, the sedative, the hypnotic, but also it had a little bit of an upper in it to really get you going as soon as you woke up. Now, these men then continued their research, and they're known for all of the extensive history of this drug because of how much they've done. Now, they introduced barbiturate therapy in 1912 with phenobarbital, where they started to actually give this drug to people who were having seizures. That was the first time it had happened. They were having seizures, or they were having different kinds of manic episodes, and some of them were extremely anxious. And so it started to be used in hospitals, and psychiatrists were using them from the development of these two gentlemen. In 1921, because of the efforts of these two gentlemen, they started to use it in anesthetics. Now, the reason why they can use it for brief episodes of epilepsy and anesthetics is that they figured out a way to make the dosage extremely small, but potent enough to make you actually actually fall asleep for an epileptic episode of potentially 10 minutes to an anesthetic procedure using anesthesia for about an hour to 2 hours. They were able to modify and synthesize these drugs in a way that they were being used in a very practical sense. Now, some things that should be known about barbiturates is that from 1920 to 1950, they were the only sedative or hypnotic used. Now, it's almost like it's a godfather of drugs to an extent, if you think about it in that way. From this barbiturate era came about the development of benzodiazepine, Valium, Xanax, and plenty of other sedatives that were going to come after it. But it's the core of the barbiturate studying that was done by these three gentlemen that made it possible for people in medicine to use drugs that like Valium or Xanax further on. Now, one thing that's also really important to know is that they continued, these two gentlemen on the end continued to synthesize drugs, and 2,500 drugs were synthesized, but only 50 were used in an actual clinical setting. Now, some of the biggest reasons for that is that they started to discover the addictive power of barbiturates. And a sad story, but just a telling story, is that both the two gentlemen on the end, von Meering and Fisher, both died of drug overdoses. Now, you might remember that Elvis Presley and Marilyn Monroe also died of barbiturate overdoses. One of the major reasons why people might overdose of barbiturates is, unfortunately, because of suicide. Essentially, you just fall asleep and don't wake up. And what's scary about the drug is that the amount that it takes to actually fall asleep from the drug, you don't need a ton more for you to actually successfully suicide. So it's a terrifying drug, and that's why we want to make sure that we understand it fully, we understand the effects of it, and then we understand possible treatment plans of it. Now, the medical sense of barbiturates is not very well known in today's sense of being used. We still use it occasionally with epileptic episodes, as well as with anesthesia. But other than that, there are very minor reasons for somebody to use it in a medical sense. Unfortunately, they're still used as a street drug, and they need to be considered as a highly deadly drug if used in the wrong way. So now we're going to continue by talking about the effects of barbiturates.
Hi, I'm Scott, and I'm going to talk about the chemical components of barbiturates. As Carrie stated, barbiturates are considered a depressant in their classification of substances. An interesting thing about barbiturates is that they are completely synthesized, so they are not based on any type of natural substance. For instance, like cocaine or marijuana or opiates, they're all based off of a natural organic component, whereas barbiturates are not. It's actually a synthesization of something called barbituric acid. Now, there are several variations of barbiturates, as Carrie discussed. One of the classifications for barbiturates has to do with how long the half-life is, or how long the chemical stays active in the system. So you have short, medium, and long-lasting forms of barbiturates. Now, the one that is most likely to be abused is the short activated barbiturates. Those stay in the system anywhere from 3 to 4 hours. As far as the effects, again, as Carrie stated, they have a sedative or hypnotic effect on a person. And actually, barbiturates, they were developed as more of a medical prescription drug, and so it's a medical prescription drug that is abused by people, and so they're actually used to treat like sleep disorders or other items where somebody needs to be sedated. That's what they were developed for, and so when they're abused, they have kind of an intoxication effect, similar to people that are impaired under alcohol use. So it's similar to being, you could say, being drunk or intoxicated with how barbiturates actually work in the person's system, what they do is they stimulate the inhibitory neurotransmitter system. This particular neurotransmitter or part of that system that barbiturates affect is the GABA channel. And what happens is the barbiturates, they keep the GABA channel opened longer than what it's supposed to be. This channel kind of opens and closes, and it keeps it open longer, and which allows for chloride ions to enter into the brain cells within the GABA channel. Now what these chloride ions do is that they attach to the different brain cells, and they actually change the electrical charge of those brain cells. And by changing the electrical charge of that, it changes the way or it makes it so that the neurons are more resistant to being stimulated. And so as those neurons get fired, they aren't getting stimulated. And that's basically how the inhibition is caused in that part of the central nervous system that causes the effects of barbiturates. Now, as far as looking at the addiction that's caused by it, so for prolonged use of barbiturates, it can cause tolerance to it. So basically, the more your body gets at it, the more tolerant it gets, which, as we know about how addiction works within the body, as your body develops a tolerance, you need more of it to get the same effect. And so that's where the physical dependence component comes into it. Your body gets dependent, or this GABA channel isn't as activated as it once was, just in normal everyday life. And so you start to need more and more of the barbiturates in order to get the same effect. And this is essentially the chemistry of how the chemical component for the addiction starting in the body. Now, normal withdrawal symptoms, so normal medical use of barbiturates, causes nausea, vomiting, agitation, and confusion. So this would be after the person comes off the barbiturate. As far as looking at more severe withdrawal symptoms, so this would be if a person is abusing barbiturates, you would find the severe withdrawal symptoms of seizures, hallucinations, possible delirium, high fever, or even death. Now, looking at some more of the components that go into addiction to barbiturates, there is a genetic component in that it's been found that, as our textbook discussed, that there can be abnormalities in a person's stop switch portion of the brain, which makes it more difficult for a person to stop using a substance after they've had it. And so that's one component of genetic addiction. And then there's also the fact that relatives or people with relatives with addictions are a lot more likely to have an addiction to barbiturates. And so there may be a hereditary component with that, which points to the genetic component of that. Also, a person's individual neurochemistry could make them more susceptible to barbiturate use, specifically looking at abnormalities in the GABA binding sites in the brain. If somebody has an abnormality there, or if the GABA system doesn't work as well, a person may be tempted to take barbiturates as a way to balance that out and essentially feel normal. And then also the environment has an effect on the addiction. Looking at those growing up in an environment with addiction, just are more susceptible to use barbiturates. Now, I found that barbiturate poisoning, which is similar to addiction or abuse, it takes place more often in hospitals, I found. So it's common in a medical setting. And in the 50s and 60s, when barbiturates were more widely used, it's been reported that there were several hundreds and thousands of deaths during that time period. As far as looking at chemical treatments or for how to treat barbiturates, and part of the danger of barbiturates as well is that they induce coma in a very short amount of time. And looking at treating barbiturates, one of the ways of where current research is looking at is using elimination. And there haven't been very effective treatments that have been put together yet. However, there has been, in using a specific type of dialysis called hemodialysis, it's been shown to have some effects in clinical studies at looking at reducing some of the toxicity of barbiturates.
Okay, so now that Scott and Carrie have talked about the history and the chemical components of barbiturates, I'm going to talk about detoxification, support, and recovery. As Scott mentioned earlier, withdrawal from barbiturates can be very severe, and because of this, safety is paramount, and detoxification should be overseen by a medical professional. Detoxification is attained by tapering drug dosages until the patient is med-free. It typically lasts 7 to 14 days, but it does depend on what dosage the patient was using before. Detox patients are at risk for life-threatening effects such as dysrhythmia, respiratory depression, coma, or death if other central nervous system depressants, such as over-the-counter cold and allergy medicine, are being taken. And because of this and the other associated risk, having your detox overseen by a medical professional is highly recommended for safety. So next I'm going to talk about support for addicts. Support plays a very critical role in successful recovery. There are a couple websites that have very easy access features for finding treatment and support groups. The first one is Rehab Center. It gives the user an opportunity to search for treatment programs in each state. Here in Colorado, when I did the search yielded 31 inpatient alcohol and drug rehab program results. On the website, you can also search for treatment programs specific to the drug you're abusing, and you can also filter the treatment programs by type of payment. So like your insurance, for insurance purposes. And when it comes to payment and figuring out those details, that can be very helpful. So another option for finding treatment programs is the Substance Abuse and Health Services Administration. Their website is www.samhsa.gov, and through this website you can also search for treatment programs as well as find behavioral health services, and they have a whole list of these national helplines. So here are the helplines. There's the National Suicide Prevention Lifeline, the National Helpline, and the Disaster Distress Helpline. You can call these helplines anytime, and just as a note, the Disaster Distress Hotline does apply to human-caused disaster as well. Another good support group for addicts is Narcotics Anonymous. It's a 12-step model similar to Alcoholics Anonymous, and it utilizes group meetings and a peer support network that enables the group to offer continuous support for the addict. The only requirement for membership in Narcotics Anonymous is a desire to stop using. They have meetings every single day of the week at various times. And here in Colorado, where I'm located, a simple search for meetings produced 30 meeting results. So let's talk a little bit about support for families, because unfortunately addiction doesn't just affect the addict, it greatly affects families and friends as well. So if you're a family member or friend of an addict, know, and this is from the Addictions and Recovery website, you did not cause the addiction, you cannot control the addiction, and you can't cure the addiction. Families may experience feelings of frustration, desperation, and exhaustion. Two very important things are to seek help and to take care of yourself. The Addictions and Recovery website has some very practical information on living or dealing with an addict, as well as a list of resources. Next up, there's Nar-Anon, which is a 12-step support group geared specifically towards those who have interactions with an addict and are affected by them. This group is anonymous, confidential, and its members know what you're going through, and they're there to help and support you. So next, let's talk about recovery. The Substance Abuse and Mental Health Services Administration defines recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Total recovery is the ultimate goal for the recovering addict. The path to recovery is going to be different for each individual, and it may have numerous setbacks. The addict is the only one who can decide to pursue recovery. I'd like to share these points from the SAMHSA website that define the aspects of recovery very well. The first one is health. SAMHSA states that it's overcoming or managing one's disease or symptoms and making informed, healthy choices that support physical and emotional well-being. Home, having a stable and safe place to live. Purpose, conducting meaningful daily activities such as jobs, school, family caretaking, or creative endeavors, and the independent income and resources to participate in society. Community, having relationships and social networks that provide support, friendship, love, and hope. Recovery continued. So we've talked about kind of the broad spectrum of recovery in health, home, purpose, and community. And then these following 10 elements are kind of the more in-depth facets of those 4 tenets. So recovery includes hope. Recovery is person-driven. There are many pathways in recovery, and it's going to be different for each individual. Recovery is holistic. It involves peer support. It is relational. Cultural can play a very big role in the pathway to recovery. Recovery addresses trauma. Recovery explores and defines strengths and responsibilities. And recovery also involves respect for yourself and respect for others. So all of these elements play a very valuable part in recovery. But as I wrap up this presentation on barbiturate drug abuse, I think it's very important to remember that addiction is a very complicated and multifaceted disease. It affects the addict and affects family and friends as well. Perhaps the one most important thing to remember is hope. As Christians, we know that we have a hope that's much greater than ourselves. It's in Christ. Hebrews 6:19 says, "We have this hope as an anchor for the soul, firm and secure." So as Christians, God's truth eternally guides us, it strengthens us, it comforts us, and it anchors us when life is far too turbulent for us to anchor ourselves, much less steer the boat. But regardless of religious belief, there's always hope. Hope in recovery, a new day, and a new start. So, if you're an addict or a family member or friend of an addict, seek help. Reach out. Call the hotline, join a support group, or walk through the doors of a treatment center. The anchor is right there in front of you. All you have to do is take hold. Thank you.